This is part 5. It's about 15 minutes later. And I had her supine a little while ago, and we were able to reduce the divot of the pubic fibrocartilage. And we seem to have created less difference between the PSIS and the sacrum. More importantly, we've improved her mobility in the transverse plane. So taking up the slack now, I see considerable mobility, especially through the lower body. And now when I spring it, her heels move much more. It's allowing movement to go down through the body, through the lower body. The spring at the ischia, I tested a while ago, and when I take up the slack, I see more movement. And when I spring it, there is a lot more available movement that translates all the way down to the lower extremity. Of course, some of it goes into the lumbar spine, but we haven't had her get off the table yet. So would you be able to come off the table and walk around a little and then tell us what your thoughts are?
Well, it feels pretty balanced and stable. I mean, I don't have any pain. Much better.
How so? What does much better mean?
Well, I don't feel pain.
You don't feel pain?
I can extend my back, and I had trouble doing that before. This
And is
UL
that,
muscle was
in
less
general,
rigid.
do you have difficulty backward bending?
Yes.
Okay.
This morning I did.
Did you? Okay. Alrighty. So can you feel in your body, do you have a sense of how things are different? I know you, in general, you feel more stable. Is that what you said?
I feel like my legs are the same height.
Okay. Okay. Can you elaborate at all on?
I feel like I'm standing more centered than I had been previously.
Nice. Nice. I like that. That speaks to me because I know when my body feels that way.
Right.
On occasion when I succeed in torquing it out of norm. So good, I'm happy to hear this, and so we need to put everything together and make sure everything we treated, such as your upper cervical, continues to behave. But tell me, how have you felt overnight in response to the upper cervical work?
You mean last night?
In general, since yesterday's treatment, how have you felt?
I felt fine as far as the cervical. I've had less neck pain, and my neck feels freer movement, and
Very good.
it feels good.
The way that your neck was restricted would limit reflexive movement. When you're walking and your right heel hits the ground, your head's supposed to rotate to the right about 5 degrees. So that enhances your peripheral vision. But when your occipito-cervical junction is as restricted as yours was, you don't have that movement. So what people oftentimes report to me is they say, you know, my vision is better. To which I say, no, it isn't. Your visual field is better when you're sitting in the car, because you're able to really easily get that first 5 degrees.
I did notice that.
And when you're walking, the visual field is open up laterally about 5 degrees.
Mm-hmm. Yeah, I did notice that yesterday. Mm-hmm.
Good. When and how?
When I was driving in the car.
You noted what?
I was able to see left and right easier.
Nice. Nice. Alrighty, so we'll stop filming here, and if we uncover anything else, we'll do another film, but it feels like we're done in terms of this case. I will create a film for you to summarize everything we did and what I want you to do to maintain the benefit. So we'll stop right here. Thanks.